This conversation with envoys of over 130 countries. Meanwhile, the big story today, it's day 6 of the coronavirus lockdown. We've got 15 more days to go, but it already seems to be paying off, at least on the face of it. And let me explain. While the total number of cases are over 1,000 in the country, just in the last 3 days alone, there has been a drop in the number of new cases. These are early indications of the benefits of the lockdown, but the government is citing this data along with comparable data from developed as well as less densely populated countries to say that some of these early measures like the lockdown, isolation, it seems to be working in stopping the spread of the rate of infections of COVID-19. Now, let's put it in terms of data. Let's break it down for you day by day. Last Wednesday, that's March the 25th, the number of new cases in India was 43. The following day, it rose sharply, it in fact more than doubled to 88. And then there was a slight dip on Friday. From 88, it came down to 75. Then on Saturday, and this is where it got worrisome, it more than doubled or almost doubled from between Friday and Saturday. It jumped up from 75 to 149. And in the last 3 days, there has been a downward trajectory. On Sunday, it came down from 149 to 106. And then today, it came down from 106 to 92. Admittedly, these are early days. There are still new cases happening. But what's the significance of this slight downward tick in the last 3 days? CNN News 18's Sneha Mordani explains.
There has been a slight reduction in the number of positive COVID-19 cases in India, is what the government of India says over the last 3 odd days, if you simply go by the data. The government, in fact, has repeatedly maintained that we are in a comfortable sort of a position. The Indian Council of Medical Research has also spoken about it, that in comparison, our preemptive measures that were taken and the people cooperating at this point in time and also announcement of a lockdown is going to help us. The results of this can only be seen after the 10th day of the lockdown, is what sources within the health ministry are in fact saying. However, the government has come on record to say that if you just gauge the data from other countries which are developed and don't have as high a population as India and also have a robust healthcare system, so to speak, their data shows that the increase in cases from 100 to even 3 or 5 or 8,000 happened in just about 12 days.
All right, let's try and make sense of this. And should we at all be looking at this data point as some kind of a sign that India is getting the benefits of this lockdown? Joining me now is Dr. Aziz Shah. He's the director at Harvard Global Health Institute. Thank you very much, Dr. Shah, for speaking with us. Obviously, you're aware of the 21-day lockdown here in India. And one of the data points that we're keenly looking at is the number of new cases, which in the last 3 days has shown a bit of a downward tick. What do we make of it? Is there enough data to suggest that perhaps this lockdown seems to be paying off?
Great question. So I would not put any stock in any numbers of infections right now. It typically takes about 2 weeks after you implement these social distancing measures to see effects on a number of cases. And so right now, if there are changes in how many people are being identified as being infected, it's really about testing. It's about how extensive the testing is, how targeted the testing is. That's what's driving the number of cases that are being identified. And we have to wait probably another week or two before we start seeing any of the data on the effects of the lockdown.
But here's the thing. Let's say in the next 14 days, let's say towards the end of the lockdown period by the middle of April, if there is a consistent downward movement in the number of new cases per day in a way that the government is confident that, okay, we can ease the restrictions, is it possible, is it in the nature of this virus that once the restrictions are lifted, this virus could once again recur maybe a month down the line, 2 months down the line, 3 months down the line? Is that possible?
Though, when the lockdown ends, the virus will flare back up again. So the lockdown is only one step in the process of controlling this virus. And if all the government does is ends the lockdown, 4 weeks later, there will be widespread infection across India again. So what we actually need is the lockdown is very important, but with the lockdown has to be a very aggressive testing strategy that tests everybody who has symptoms, their contacts, as well as a sample of people who are otherwise feeling fine. And you also need to isolate people who are identified as having been infected. So the strategy has to be that right now, India needs to use this time in the lockdown to build a national testing capacity infrastructure, and then start testing people very, very aggressively. And when the lockdown is lifted, continue that testing, and then identify people who are infected and isolate them from the community. And that's the only strategy. Or 4 weeks later, India will need another lockdown again.
The reason I asked you that is obviously, I mean, there is a price to pay. You can't keep a country like India in lockdown in perpetuity. And this is a debate that's happening in the US as well, where you are, where Trump wants to open up America by Easter Sunday, which is 2 weeks from now. The question really is, by when does the government get the confidence to say, okay, we can ease some of these restrictions, we can ease this lockdown?
So I always say, to quote one of the leaders here, we don't get to make the timeline, the virus makes the timeline. And the way this works is, I think it's great that India is doing the 21-day lockdown. That's exactly what is needed. But you have to use that time to build up the testing infrastructure, because if you don't, you're going to be back in lockdown. And the economic and personal costs of that are going to be very large.
Absolutely.
So if you want to avoid a second lockdown 2 months from now, the key is to build a testing infrastructure and have widespread testing across India, testing tied to isolation, contact tracing. That's the only way to avoid further lockdowns. There is no third option.
Okay, all right. Thank you very much, Dr. Aziz Shah, for very succinctly putting that in perspective for us. So it's not just about the lockdown, it's also about testing. That's what the WHO chief had said as well. And at the same time, using those tests and then isolating the people who have come, who have turned positive, COVID positive, and then also contact tracing those who they may have come into contact with. Also now joining me is Dr. P Raghuram. He's a Padma Shri awardee. He's the founder, CEO and director at the Usha Lakshmi Breast Cancer Foundation. I'm sure you heard parts of what Dr. Jha had to say. The question really, Dr. Ram, everybody who's watching this program at home, everybody who's in lockdown is asking is this. Okay, we're prepared for 21 days. We're prepared to go on till the 14th of April. But will this lockdown continue further than that? From purely a health point of view, what is it that the government needs to look out for where they can be comfortable at the end of this 21-day period and say, okay, maybe we can ease some of these restrictions?
Yes, good evening. Thank you for having me on your show. The Cabinet Secretary today released a press statement stating that the lockdown will be for 21 days.
Sure.
So the lockdown effects will be shown in 10 days' time. And the early signs, the number reduction now, today and yesterday, are good indicators. But alongside the lockdown, we have this window of opportunity, and the country has implemented the world's largest experiment of implementing a countrywide lockdown in the second most populous country in the world. And by and large, we have done very well in terms of the lockdown, barring the significant and distressing, visuals that we're seeing in terms of the daily wage laborers who have migrated and they are not able to get home, and some of them have died. This is very, very disturbing. But the lockdown of 21 days is a window of opportunity for India to undertake three major things. The first and foremost thing is we are at war.
Yes.
And in any war, the foot soldiers are the healthcare workers. And it is very important that all the healthcare workers have access to decent personal protection equipment, which at the moment is not available. The government has ordered for about 10 lakh personal protection equipment sets as of 23rd of March. And they have indigenized, they've identified 11 companies, and they hope to make 5,000 personal protection equipments by, every day. But still, that won't be enough. We require about 10 lakh personal protection equipment, which will take something like 3 to 4 months. So we should be very aggressive in procuring this from wherever in the world and make the healthcare professionals comfortable. Because
can you just explain to us very succinctly, if you could explain to our viewers, because our viewers are still trying to also grapple around this issue. A lot of doctors, nurses, especially on social media, have been putting up almost SOS-like messages saying we don't have adequate PPEs.
Yes.
Can you explain to us why, that's so critical, especially in the context of globally also, it's a large number of health workers who've actually become potential victims of COVID?
Indeed. In a country like China, as of first week of March, I don't know the figures now, more than 4,000 healthcare workers were infected. And a large number of healthcare workers will obviously get infected if they don't take personal protection. Just as we are following the social distancing of at least 2 meters at home, and then we are on a lockdown, we expect healthcare workers to deal with COVID positive patients or potentially suspected COVID positive patients with just wearing a surgical mask, where they will definitely get infected. And when they get infected, and if they are a little older, then you have the issue of they themselves will become hospitalized when you don't have doctors to look after patients. And also equally disturbing when doctors succumb to the illness in front of patients who look up to doctors for saving their lives, then it's very distressing. So this is the first thing that the government should take care. The second most important thing is testing. We have done 38,000 tests so far. And as the ICMR has stated, we have only tested to 30% of the capacity that India can test. And US has already done 550,000. So a country with a population of 1.3 billion must be undertaking more tests more rigorously. We have got 115 ICMR labs and 47 private labs. So we should step it up. And the final thing is the level of preparedness. We don't have adequate ICU beds. We have something like 40 to 50,000 ICU beds, which is grossly inadequate. We have something like 2 ICU beds for a population of 100,000. So this must be certainly ramped up, and we need to have robust hospital facilities with adequate manpower to deal with this. And we need to utilize this lockdown for this purpose.
All right, Dr. Raghuram, thank you very much for speaking with us. Unfortunately, we have a paucity of time, but thank you very much indeed. All those points are well taken indeed. Now, one of the points that the doctor was referring to, and we've seen these really heart-wrenching pictures over the last few days of tens of thousands of migrants heading home, and that is posing an even greater health risk, not just to them, but also to the wider community. All of this in the midst of the corona crisis. The News18 network is the only group. We have 20 channels, 1,200 reporters across the country. It allows us to bring you stories from every nook and cranny of this country, not just cover every aspect of COVID-19, but also this migrant exodus. And make no mistake, this migrant exodus is clearly a fallout of the fear that people are experiencing, and that's why they are now migrating to their villages, to their native places, where again, from large parts of India, from villages, we're getting reports that these migrants are being kept outside the limits of the villages, some of them being housed in government schools, etc., without being reunited with their families. Joining me now on the show is Chinmay Tumbe. He's an assistant professor at IIM Ahmedabad. Thank you very much, Mr. Tumbe, for speaking with us. You had put out a map sometime earlier about the hotspots, the migrant hotspots, as you put it. Are we seeing the most amount of reverse migration from cities to villages in those places? Do you see enough being done both by centre and state in those hotspots? Just walk us through what can be done now to deal with this massive reverse migration that we're seeing.
Yeah, I think the migration corridors of India have been well documented. And those maps tell you the clear clusters in which a lot of migrants have gone back home in the last, not just the last few days, but the last 2 weeks. And so it's important that those districts do have better or more facilities than some of the other districts, simply in terms of capacity of testing, one hopes that none of those migrants are carrying the virus back home. But if at all some of them are, there has to be a very humane way of going about it instead of just a very strict sort of method, which unfortunately today very disturbing visuals sort of came out. So one hopes that certain clusters, migrant source region clusters, because there has been a precedent where epidemics have been transferred in India through migrant workers. And so it's important to be prepared for such outcomes.
The question, though, is, and this is the big challenge for policymakers, how do you make them stay? Because clearly, if they're going to migrate back in the numbers that we're seeing, it defeats the whole purpose of a lockdown. How do you give them enough sense of security so that they can stay where they are?
I think there are two things here. One is, migrants get social security back home, and they get economic security in the city, in the large cities. And so when you announce a lockdown without any, immediate preparations for migrant workers, the first fear that, came across for many was economic insecurity. And so if you get social security back home, if your family is going to provide for you, then you want to go back immediately. So I think now the provisions announced yesterday, I think will go a long way in alleviating some of these fears of migrant workers. There will obviously be a few who will still try and scramble back. But I think what the mistake, I think, for about four days after the announcement was not enough action on the ground to sort of tell migrant workers that all your economic concerns will be taken care of by state or central government. I think that messaging was a bit late, but now that it's been done, I think yesterday there was a very strong message that was sent out. I do think that now you'll see these numbers sort of reduce
coming down,
and people sort of adapt in the city. Given that now there's a rental waiver, 1 month no rent.
Correct.
Given that there's much more awareness of access to food, a lot of people, a lot of civil society organizations working around the clock to help migrant workers. So there's that much more awareness built up in the last 3 days, which I think is very important. And I think you'll see a reduced need for such an exodus.
All right, Professor Chinmay Tumbe from IIM Ahmedabad, thanks very much for joining us and putting that story into perspective. Now, hours after being pulled up by the Uttar Pradesh Chief Minister Yogi Adityanath over lapses in containing the COVID pandemic, B.N. Singh has now been sacked as the Noida District Magistrate. Yogi Adityanath had removed him from the job for asking for a 3-month leave, despite the number of cases in Noida now crossing 30. Noida is fast becoming a hotspot, not just in the state of Uttar Pradesh, but also possibly in the wider country.
बकवास मत बंद करो अपना, ठीक है? बकवास कर करके आप लोगों ने माहौल खराब किया है यहाँ पे। जिम्मेदारियों का निर्वहन करने की बजाय एक दूसरे के ऊपर वो डालना, और 2 महीने पहले अलर्ट जारी किया था हम लोगों ने यहाँ पे, पूरे प्रदेश के लिए जारी किया था।
Meanwhile, the Bareilly District Magistrate has also promised action against local authorities who were caught on camera doing this, spraying disinfectants on a group of migrant laborers. The action comes after the video sparked massive outrage. And another story that's sparking outrage, a major healthcare crisis in the national capital, where at least 200 people have now been quarantined in Delhi's Nizamuddin area. This after 7 people tested positive for the coronavirus. The entire Nizamuddin area has now been cordoned off. The infected lot, in fact, took part in a religious gathering a few days ago. They clearly violated the lockdown as the event was organized without any police permission. Authorities are now trying to do contact tracing, but that is going to be a Herculean task. Nearly 2,000 people reportedly had taken part in that event. Reliance Industries is contributing 500 crores to the Prime Minister's relief fund, which is called PM Cares, for migrant as well as homeless people who've been affected in the 21-day lockdown. In addition to that, Reliance will also be sponsoring 50 lakh free meals for the poor over the next 10 days. Reliance has already built India's first state-of-the-art 100-bed dedicated COVID-19 hospital as well. Now, let's talk about some global corona cases. With more than 97,000 positive cases of the virus, Italy is in line to become the second highest country in the world. It's going to break the 100,000 mark. Remember, the US is the only country right now in the world where there are more than 1 lakh positive cases of corona. Young doctors who are fresh out of medical school are being fast-tracked to fight the corona war on the front lines in Italy. Talking about the high and mighty, Israeli Prime Minister Benjamin Netanyahu is also in quarantine after his aide tested positive for coronavirus. Netanyahu met his aide last week during a parliament session. Israel has reported 15 deaths and more than 4,000 coronavirus cases. Russia's capital, Moscow, has imposed a citywide quarantine starting today. People will not be able to leave their homes except to get groceries or medical help. Russia has halted international flights and closed its borders.